So I have the pleasure of introducing the people who are going to be speaking today, and I also have the pleasure of talking a little bit about what integrative medicine is. And it's one of my favorite subjects. Where's Denny that I was just talking to? Denny. Denny was just talking earlier today about the beginning of Plane Tree, and I thought it really incorporated the beginnings of integrative medicine, but also what integrative medicine is all about. With Plane Tree, the originator of that organization came to the United States, needed to be hospitalized, and was very concerned about the way we hospitalized people here. It was very impersonal and didn't feel like a healing environment. And so Plane Tree was one of the first sort of integrative medicine. It wasn't called that at the time, but it was one of the first integrative medicine in hospital programs to create a more loving, healing environment for that created a place where you could heal more deeply. And so families were invited to stay. They were given places where they could cook for the sick person and those types of things. And so I thought that was just a beautiful story, so I just wanted to share it as well, because it really does encapsulate what integrative medicine is all about in looking at health and healing. So I wanted to give you a little bit of an idea of what would be different if you came to get an integrative medicine consult with one of the physicians, but also the other practitioners that work at the IHH. So somebody comes in and maybe they have gastrointestinal issues, and so they've seen their gastroenterologist about that. And they also have headaches, so they saw a neurologist. They had fatigue, so they went to their primary care doctor, and the primary care doctor saw that they had an issue with their thyroid, so they sent them to an endocrinologist. And pretty soon you're on a whole bunch of medicines, and each one is something separate from the others. What happens in an integrative medicine consult is there is a recognition that all of those are connected. They're all you. They have to be connected. And so looking at it from that, sometimes I feel like I'm a detective of trying to figure out how those are connected and how to find the underlying cause for the issues instead of just treating the symptom, one symptom after another. Because if you find the underlying cause, then you're more likely to not only deal with the symptoms that are going on, but also to prevent other symptoms in the future. So that's one piece of it on the physical level. But there's much more to integrative medicine. There's the emotional side of things. So if I work with someone, I'm also asking questions about their relationships with their spouse and their children, and sexuality, and all those types of issues as well. And because your relationship with your spouse, how many of you think your relationship with your spouse affects your health? Okay, well, I don't need to convince you. You got it. So how often have you been asked by your doctor about your relationship with your spouse? Yeah. And so if that is an important thing, and they do look at that, and I can give you the biochemical causes for why that is, and I could get into the whole biochemistry of IL-6, and IL-6 is an inflammatory marker that goes up when you have emotional stress, and that adds to inflammation in the rest of your body, which decreases your immune system and adds to cortisol, and I could go on and on about the biochemistry of it. But the bottom line is your relationship is affecting your health. Same with parenting, same with sleep, same with how you're eating. All of those impact you in many ways that if they're not paid attention to, can impact your health in lots of different ways. So we look at it from those aspects as well. On a third side of what we look at is the psychospiritual. One of the things with the American Holistic Medical Association on we have a list of 10 things that the American Holistic Medical Association doctors stand for. And one of them is love is the ultimate healer. And I see love as a psychospiritual issue. I don't mean spirituality in terms of religion. I'm not talking about a religion at all. I'm talking about your connections. The connections first to yourself. Are you in right relationship with yourself? And that can come in the form of diet and exercise and sleep and all of that, but it might also have to do with How are you handling the illness that you're dealing with? Are you spending the time angry at your pain, or feeling like this shouldn't be because you're dealing with an illness? So it starts with the relationship to yourself. Then it goes in ever-widening circles. Are you in right relationship to the people that you love? Are you in right relationship to the people that you don't love? Oftentimes that's not asked about. Oftentimes that's work. Okay. Are you in right relationship with that? And again, in ever-widening circles, do you have a community that you are a part of? Again, I can go off on the research on the health benefits of communities. And in your community, is there a fair share of energies? Is there as much going out as there is coming in? And vice versa. In terms of something bigger than yourself, a higher power, if that is something that fits within your cosmology, are you in right relationship with that, or does that feel punishing, or do you feel disconnected from that? And then the questions of meaning and purpose and joy and juiciness. We were just talking today. Juiciness is one of my favorite words. It's a great one. You know, are you juicy in your life? Is there joy? You know, sometimes I ask people when they're feeling depressed, what was the last thing you did that was joyful? And they say, I can't remember. I said, well, then your depression is appropriate. So then the question is, how do you bring more joy into your life? So those are some of the things that we look at when we're looking at somebody from an integrative approach. Now, when I talk about integrative, I'm not talking about alternative. Alternative means that we're not, we're throwing out Western medicine, Western allopathic medicine. That's not the case at all. We're looking at it from all those methods. Those are tools in our toolbox as well. But the other pieces, the mind, the body, the emotions, and spirit, if you look at that as all connected, then the question is, how are they connected? Not only in terms of what's out of balance, but what's in balance? What are your strengths? And how do we make good use of your strengths to make your life more happy, joyful, juicy? And so looking at it from all those angles, as you can imagine, that it covers a lot, and it's a big conversation. But what we do with integrative medicine is we start to look at, where the energy is. I follow the energy. And so whatever's up is up for healing. So for some person, they might come in and what's really going on is they've got gastrointestinal issues or they've got fatigue, and we start heading down a physical path. But for someone else, maybe what's really going on is they don't feel connected to their world. And they're spending a lot of time going through the motions and not realizing why they're going through the motions. And if that's what's going on, I could fix their GI tract, but that's still not going to give them a happy, healthy, joyful, meaningful, and purposeful life. And if that's the goal, then we're looking over here. It's sort of like you're looking for the keys in the place that has the most light, and that's when you actually lost the keys over there, where it's a little darker. So that's the goal of integrative medicine. And in terms of the physical, yes, there are medicines that we can use, prescribed medicines. Surgery is an option. It's sometimes the most appropriate thing. But what we look at is how to find the tools that have the least risk with the most benefit. And in looking at that, we try to bring in the research of, I often say to people that I don't practice medicine the same way I did 5 years ago, and I will not practice this same way 5 years from now. Hopefully I've learned a few things because more research has come out and changed the way I've practiced medicine. And that's the goal of integrative medicine as well. So when we talk about the other modalities in integrative medicine, you're going to be hearing some amazing speakers tonight. And they're going to be talking about different aspects of health and healing within the realm of the brain